Dahod district after a joyous wedding celebration that turned into a large-scale health emergency. More than 400 guests reportedly fell ill in what authorities suspect to be a major case of food poisoning. What began as a festive gathering quickly descended into distress as attendees started experiencing symptoms such as nausea, vomiting, stomach pain and dizziness just hours after consuming food at the event. Eyewitness accounts describe a rapidly escalating situation with multiple guests falling sick almost simultaneously. Families rushed their loved ones to nearby hospitals, overwhelming local healthcare facilities. Several individuals had to be admitted for treatment, while others were given immediate medical attention and discharged. Health officials responded swiftly, deploying teams to the village in order to assess the entire situation, provide treatment and prevent further complications. District authorities have launched an investigation into the incident, collecting food samples from the wedding feast in order to identify the source of contamination. However, the exact cause has not yet been confirmed. Officials are also examining food preparation practices, storage conditions, and hygiene standards followed during the event. And this incident has raised serious concerns about food safety at large gatherings, particularly in rural areas where monitoring can be limited. Well, this alarming episode in Dahod is not an isolated case, but part of a troubling pattern emerging across Gujarat. As in recent weeks, multiple food poisoning incidents have been reported, highlighting systematic gaps in food safety enforcement. Earlier this month, a girls' hostel in Ahmedabad witnessed a similar scare when 57 students fell ill after consuming contaminated food. And the students suffered from severe diarrhea, nausea and vomiting, with 38 requiring hospitalization within 24 hours. Medical teams worked around the clock to stabilize the affected students, many of whom were later discharged after initial treatment. Another incident occurred in Rajpura village under Dahod Taluka in Ahmedabad district, where nearly 100 people fell ill after consuming Safe Harmony, a popular local snack, during a religious program. And of those affected, 38 individuals were hospitalized while others received preventive care. Health authorities also reported that all the patients were eventually stabilized, but the incident further underscored the recurring nature of such outbreaks. Similar concerns have also surfaced outside Gujarat. As in Uttarakhand's Tehri district, around 3 dozen people fell ill after consuming food at a wedding. Most of the affected were women and children from nearby villages, and they reported symptoms such as vomiting, diarrhea and stomach pain. Patients began arriving at the district hospital in phases, with several admitted for observation while others were treated and discharged. Medical officials confirmed that all the patients were stable and food samples were collected for testing. And in response to all these repeated incidents, food safety departments have intensified their efforts. Investigations are underway in all the affected regions, with authorities collecting samples of food items such as flour, pulses, gram flour, and noodles for laboratory analysis. Officials aim to identify contaminants and determine whether negligence, improper handling, or external factors contributed to such outbreaks. And the situation in Dahod remains under close watch, with health teams continuing to monitor affected individuals and ensure that no further spread of illness. Well, all these incidents collectively highlight the urgent need for stricter food safety regulations, better awareness among food handlers, and improved monitoring at large gatherings. And as the investigations continue, authorities face mounting pressure to identify the root causes and implement measures in order to prevent such dangerous outbreaks in the near future. Notably, panic and chaos swept through a village in Gujarat's Dahod district after a joyous wedding celebration that turned into a large-scale health emergency. More than 400 guests reportedly fell ill, and authorities described it as a case of food poisoning. What began as a festive gathering quickly descended into distress as attendees started experiencing symptoms such as nausea, vomiting, stomach pain and dizziness just hours after consuming food at the event.
कल शाम को दाहोद जिले में गरबड़ा तालुका में अबलोड गांव में वहाँ कोई मैरिज फंक्शन था। मैरिज फंक्शन में 300-400 लोग का फंक्शन में आए होंगे। सब लोगों ने जो भी खाना बनाया था वो खाया। इसके बाद 7 से 8 के बीच में खाना खाया और रात को 11 बजे स्टार्ट हुआ। वॉमिटिंग और डायरिया जैसा सिम्टम सबको लगा। इसके बाद तुरंत गवर्नमेंट की टीम सीडीएचओ ऑफिसर एंड एपिडेमिक ऑफिसर सब वहाँ का टीएचओ सब मिलके वहाँ केस का डिटेक्शन करके जो ट्रीटमेंट देना था वो वहाँ दिया। इसके बाद जो पेशेंट ज़्यादा थोड़ा दिक्कत था उसको 108 एम्बुलेंस में झाड़स हॉस्पिटल में लेके आए। यहाँ हमारी टीम पूरी तैयारी थी। हमको जब पता चला कि 150 के तो 150 से 200 के आसपास यहाँ आने वाले हैं, तो हमने सब बेड तैयार करके और हमारी टीम इमरजेंसी में सब लोग मिलके काम करने लगे और सब पेशेंट को हमारी हॉस्पिटल में अराउंड 50 to 60 आसपास हॉस्पिटल में अभी भर्ती है सब। हाँ, सबके भी स्थिति सब स्टेबल है और सबका ट्रीटमेंट चल रहा है अभी। डॉक्टर राजीव डाम और आरएमओ झाडस हॉस्पिटल दाहोद।
That's all for now. Stay tuned to the Savera for more updates. Do like, comment and subscribe to the channel.